Bismillahirrahmanirrahim. Assalamu alaikum everyone. My name is Dr. Rafia Shah. I'm a dental surgeon and I'm working as a lecturer at Liaquat University of Medical and Health Sciences, Jamshedpur. Today I am going to give you an overview of orthodontics since it's my first lecture, and I would expect from you all that you will love it, you will like it, and hopefully I would be able to explain it in a very simpler and in a nice way. So friends, let's begin with overview of orthodontics. Here I'll be telling you what is orthodontics, what is the purpose of orthodontics, what are the branches of orthodontics, what is the scope of orthodontics in dentistry, and what are the indications and contraindications of orthodontics. Before beginning, we shall understand the term orthodontics. Orthodontics is a branch of dentistry that deals with diagnosis, prevention, and correction of malpositioned teeth and jaws. There are a lot of branches of dentistry, those are dealing with different problems, but when we are talking about orthodontics, that is mainly concerned with misposition or malpositioned teeth and the jaws. Means orthodontics is concerned with diagnosis of malpositioned teeth and jaws. First, we need to diagnose whether the problem is lying in the teeth or whether the problem is lying among the jaws. Once we have diagnosed, we will treat accordingly. Second thing is we take some step to prevent any problem which arises due to malpositioned teeth and jaws. For example, a patient has come to you with crowded lower arch. And you know for sure, because due to this crowding, the patient will have more chances of the stagnation of the food. And that food stagnation in different areas will ultimately lead to caries and will lead to periodontal problems. Or any other problem like the patient after periodontal problem, the patient will have halitosis and maybe he will have tooth loss early. So to prevent that issue to occur, an orthodontist take a step to prevent this situation to arise due to malpositioned teeth. So what an orthodontist will do, orthodontist will try to treat in order to prevent other related problems to occur. And finally, we are concerned with correction of malposition or mispositioned teeth and the jaws. So in a simpler way, what is orthodontics? It is a specialty of a dentistry that deals with diagnosis of the problem present either among the teeth or among the jaws. Then we take a step forward to prevent any further problem of the oral cavity which arise due to such malpositioned teeth and the jaws. And then finally, we do correction of those malpositioned teeth and the jaws. Orthodontics also focus on modification of facial growth. When I'm talking about jaws, it means when we are going to treat the jaws, ultimately there'll be change in the face, the growth of the face. If the patient is at the growing age, the spurt is present at that time, the step we will take that will be modifying the facial growth. So for example, this is the maxilla of the mandible, maxilla of the patient, and this is mandible. Normally we say there has to be 2 millimeter difference. Maxilla is normally 2 millimeter ahead of mandible. But if the case is not so, the case is like this. Maxilla is here and the mandible is here. Means maxilla is at its place. Just one scenario I'm telling you. And here is the mandible which is gone forward. Instead of maxilla to be 2 mm ahead of mandible, here mandible is ahead of maxilla. Means the normal position was this, which has to be like this. Maxilla ahead of mandible. But Here the mandible is ahead of maxilla. It means the patient is not having is not having proper jaw relationship. So once we alter this jaw relationship, ultimately the patient will have modification of facial growth. So we do modify facial growth in orthodontics. So simply, I'm repeating it. Orthodontics is a branch of dentistry that deals with diagnosis and prevention of malposition teeth and jaws. And it does focus on growth modification, facial growth modification. So we do call it a dentofacial orthodontics. According to Burke, orthodontics include the study of growth and development of the jaws and face particularly and body generally, as influencing the position of teeth. Orthodontics includes the study of growth and development. Means this is the branch of dentistry in which I told you we can alter the position of jaws. We can alter the position of jaws when the jaw relationship can be altered mostly during the growth stage. So it is the study in which we do study about growth and development of the jaws. We do treatment of malposition jaws. Particularly, we are dealing with the face, particularly because your jaws and your teeth are present there in the face. Jaws and your teeth are particularly treated with orthodontics. But it does affect the body generally. How? Just simply take an example of a patient having proclined central incisors. Here, the upper central incisors of that patient are proclined. When the central incisors are proclined, means they are more protruded or they are more out than the lower counterpart. What will happen that this patient, due to this increased proclination, patient is not having good aesthetics. Due to that compromised aesthetic, patient is unable to eat properly, patient is unable to close lips properly, patient is having no confidence to go out, patient is introvert. So all these things which are affecting the body generally. The problem is affecting the body. Patient is unable to eat properly, patient is not able to close his lips, patient is not outgoing, patient is shy and reserved. When you treat the jaws and the teeth, ultimately you are providing a change on the body as well. So once I treat a patient with proclined teeth, it means I am giving that patient several things. Like once I have treated his proclined teeth, now teeth are in a proper occlusion, patient is able to eat properly. Number one. Number two, he's able to see, he is able to close his mouth properly. The lips are having good seal, so that's why there is no further proclination of teeth. There is no further periodontal problem. There is no further halitosis. There is no abnormal swelling pattern. This will ultimately again go to affect his body in a general way. Number third, we said due to proclined teeth, patient is not having confidence to go out because according to him, his aesthetic is not good. He's having no good facial appearance. He's introvert. So once we treat that patient, we provide good aesthetic. Ultimately, we are giving patient confidence. We are giving patient good aesthetics. We are giving patient, like a proper, appearance. So all these things are, all these things which are particularly associated with the problem in the jaws and the face are generally affecting his body. So here, the study of action and reaction of internal and external influences of development and prevention and correction of arrested and perverted development means ultimately how the problem will arise due to either the internal influence or due to the external influence. For example, the internal influence or that is affecting the growth of the patient, internal influence could be the patient's, patient is having blocked nose and patient is having a mouth breathing habit. Due to that mouth breathing, patient is having developmental problems. External influence, for example, a child is having thumb sucking habit. Due to that influence, again, there is a change on the normal development and growth of a patient. So there could be a lot of, orthodontics problem. So what an orthodontist will do will prevent and correct all those problems which are arising due to any influence, external or internal. Branches of orthodontics. We are having 4 branches of orthodontics: preventive orthodontics, interceptive orthodontics, corrective orthodontics, and surgical orthodontics. As the word itself is self-explanatory, preventive. Preventive means on examination of the oral cavity of any patient with some abnormal habit. I have found, for example, a child with the thumb sucking habit. I know in future the child will have a lot of orthodontic issues, and to prevent those issues, I will start my treatment before the problem arises. That means after watching or after noticing the habit of a patient, I reached to the conclusion that this child will have problem in future. So means preventive orthodontics is done when there is no problem, means no orthodontic problem present yet. The step is taken before the problem arises. There is no problem and no orthodontic problem in the oral cavity, but we suspect there will be a problem. To prevent that problem, I will take a step, or we will take a step, that is called preventive orthodontics. Interceptive orthodontics means there is a problem, partial problem present, intercept. The word is again telling you intercept means you are interrupting in between. The problem is lying here, but you did not allow the problem to reach to the extreme level. We are interrupting in between. We are intercepting. So interceptive orthodontics is done when there is a problem lying in the arch. You interrupt it in between to prevent further, to prevent the problem to occur at more extreme level. Then corrective orthodontics, again, it means there is 100% problem lying in the oral cavity, means the problem, orthodontic problem, is 100% pure. We are going to correct it. Then surgical orthodontics is done when the jaws, maxilla or mandible cannot be treated with orthodontics alone. Then we need to go for surgical treatment, and along with surgical treatment, we do orthodontic treatment. I will repeat again, there are 4 branches of orthodontics. One is called preventive orthodontics, interceptive, then corrective, then surgical. I'll be explaining each and every branch separately. Preventive orthodontics. You see, this is action taken to preserve the integrity of what appears normal for that age. Means this is a child, with mixed dentition. Now, can you see your central incisor, lateral incisor, then premolar, then molar, means first premolar. Here is no second premolar. This is deciduous molar. This is deciduous canine. Okay. to this side. If you see these two permanent teeth, and this is a permanent tooth, and this is again a permanent tooth. Now here, if you compare this side of the arch with this side of the arch, you see this deciduous molar, deciduous second molar, deciduous second molar. This deciduous second molar is not present here. It is shed off. Due to this shedding, maybe it is shed off early. So that's why a dentist knows, an orthodontist knows, after the examination of the oral cavity, orthodontists know that this tooth is shed before time, or maybe due to any reason an orthodontist or surgeon has removed the tooth. Now orthodontist knows that if he is not going to preserve this space, what will happen? The teeth which are present adjacent to the space, this tooth and this tooth, they will try to drift into this space which is empty. They will try to drift to the empty space. Means the premolar will drift backward and the molar will drift forward. When these both teeth will drift, what will happen? There will be no sufficient space for a molar, or second premolar, which is supposed to come over here. That will ultimately go to either on the palatal side or will arise either from the buccal side. I'm repeating again that if, for example, we did not give this space maintainer to the child, the teeth are having normal tendency to move. When there is no contact between the premolar and there is no contact or any tooth present between the molar, what will happen? Both the teeth will try to drift into the empty space. To prevent their movement into the empty space, there we know our second premolar will arise. An orthodontist plans to give some sort of appliance that is called as space maintainer. Since it is a fixed type of a space maintainer, so it is called fixed space maintainer. It is given here, this tooth and this tooth. These both teeth are bonded. Sorry, they are banded. Once they are banded, then this particular metallic rod is bonded over them. This wire, which is bonded over these two banded teeth, will not allow both the teeth to drift into the empty space. Once they will not drift to the empty space, this space will be maintained for the premolar, second premolar, which is supposed to come at this space. So what did an orthodontist do? An orthodontist prevented the problem or future problem, or this problem which he was suspecting to arise. So he prevented the integrity of the arch. He did not allow any tooth to drift into the space of a tooth which did not arise yet. This way, malocclusion is prevented. Otherwise, once this space would have been occupied by these two teeth, what would happen? The tooth which is supposed to come over here would have either arrived from palatal side or would have arose from buccal side. So this is called preventive orthodontics, and there are a lot of other examples which are coming into preventive orthodontics. Inshallah, in the next classes, I'll be talking on each and every branch in a detail. So we'll be discussing them later. Just right now, I'm giving an overview. Now, interceptive orthodontics. Can you look here in the picture that a baby is having habit of thumb sucking? Okay, we are interrupting. See, interceptive means you are going to interrupt in between. The child is having habit of thumb sucking. Due to thumb sucking habit, what has happened? His upper and lower teeth are not in a proper occlusion. There is an open bite. There is no good contact, and there is a space open. This open space is called open bite. This particular space is called, which is due to thumb sucking habit, the child is having open space between the front teeth, so it is called open bite. There could be a open bite due to any other reason, but at the moment this open bite is due to this thumb sucking habit. Because of this thumb, continuous thumb sucking, what happens? The child is keeping thumb in between the upper and the lower teeth. What is happening? The upper teeth, due to the pressure of the thumb, the upper teeth are forced inward. Upward and inward means they are going to intrude, and lower teeth are also going toward intrusion. Intrusion means they are going back into the bone. So due to that intrusion, number one, the child is having open bite. Second thing, when due to thumb sucking, the jaw is continuously open. The jaw is continuously open. What happens? Since the child is in a growing stage, due to continuous opening of the jaw, what is happening? Your mandible is directed more downward. His mandible is directed more downward. This could be another reason of an open bite due to skeleton problem in this particular case. So this is interceptive orthodontics, is science and art of orthodontics employed to recognize and eliminate the potential irregularities in the developing dentofacial complex. The child is in the growth stage. We know that this habit will lead to a lot of problems in the future, although some of the problem is there, but we want to prevent further problems to arise. So we have taken a step that is called as interceptive orthodontics. Means we are interrupting in between. Then corrective orthodontics. Means the problem, as I told you here, the problem is 100% line. You cannot prevent the problem or you cannot intercept in between. Now there is the problem is a mature problem there, or existing malocclusion we can see. So in this case, we need technical procedures to eliminate the problem. We need technical procedures to eliminate the problem. Means first we need to diagnose, then there are a lot of ways we diagnose the orthodontic problem. We need to make the cast, we need to have radiographs. Then on the radiographs, we do proper cephalometric analysis. Accordingly, we treat the case. Then we have to see whether the case is to be treated with fixed orthodontic appliances. We need to see whether the case is to be treated with fixed and functional appliances. So the problem is 100% malocclusion is present, and we need to treat it accordingly in a very technical way. Can you see here? This is the open bite. Here the patient is given orthodontics, fixed orthodontic appliances. These are brackets applied over the teeth, over which the wires and elastics and everything is placed. We will be discussing this later when we'll be going further to the detail. And finally, the patient is treated, and can you see here the patient is having good occlusion. In the last picture I showed you, when the child was having habit of thumb sucking, due to thumb sucking, this space was open, that is called open bite. Can you see here? Again, this is open bite. Open bite is not a normal occlusion. This is abnormal occlusion. To have a proper occlusion, you shall have your upper and lower teeth in contact. The upper teeth are overlapping the lower teeth. Normally, the upper teeth overlap the lower teeth, and then it is called normal occlusion, which was not present before. So corrective orthodontics was done to eliminate the problem and treat the problem. Here the problem was there, now the problem is eliminated and treated with proper technical procedures. Finally, the fourth branch of orthodontics, that is called surgical orthodontics. Surgical orthodontic is done when the problem of the bone or the problem is present at a very severe level, at the dentofacial deformity. A severe dentofacial deformity is present. Dento means teeth, and facial. Both dentofacial deformity is present, which cannot be treated with orthodontics alone. So we need to have a combination of both orthodontic and surgical treatment. As I told you, for example, this is the patient. This is the patient with class 3. Here the jaw, the lower jaw, mandible is protruded. And due to this protrusion, the patient is having, an ugly appearance. Maybe the patient says, I'm not looking good, my appearance is bad. Or not only the appearance, but he's having a lot of problems. He cannot chew properly. He cannot, have proper nourishment due to that. He's having psychological issue and so many things. Now, orthodontists know that the problem is not only at the dental level. The problem is at the skeletal level, here, in the bone. So what will happen? You just take an example here. It's given the face was here before. Can you see here? The bones were more protruded. So the surgery is done and the maxilla is taken back as well as the mandible is taken back. This is bimax protrusion, bimaxillary protrusion. Means both maxilla and mandible, they both are protruded. So both are treated. The maxilla is treated with surgery. You can easily see the plates applied over here. And also the mandible is treated with surgery and it is positioned backward. So when the treatment is done along with surgery, it means that only orthodontic treatment was not giving us result. This is beyond the level of orthodontics alone. So need to have surgical treatment. So that is called surgical orthodontics. What are the aims of orthodontics? The aims of orthodontics are actually given by Jackson. That's why we call them Jackson train. First aim is we shall provide good function to the patient. For example, a patient has come to you with proclined teeth, and you only think that no, he just need to have a good appearance, and that's why he came to you, and you are just concerned with the aesthetics. No, you have to think of its function before everything. Okay, you retrocline the teeth, the patient is having good aesthetic, but there is no good contact among the teeth, patient is not able to chew properly. So that's going to be the, again, worst scenario. First important, the first aim of orthodontic treatment is we shall provide a proper functional efficacy, then static harmony, and then structural balance. Structural balance, and we'll be discussing on all the things separately in the next slide. Functional efficiency. Due to malocclusion, I told you before, due to malocclusion, the patient will not have normal, due to malocclusion, patient will not have normal chewing, may not have a normal chewing pattern. Maybe the occlusion is like that, there is no good contact, or maybe the occlusion is like that, is the central teeth are there, the central upper and the lower centrals are proclined. Due to that, the upper teeth are blocked and lower teeth are, not permitting the upper teeth to have a good bite. So this way, what will happen? The patient, due to malocclusion, the normal function would not be performed by the patient. So what we will do is, our aim is to improve the function first. Then second thing we will do is, we shall provide a good structural balance. See, we are not only concerned with the teeth, like, okay, the patient has come to me, I'm treating with the teeth, and that's it, and patient will go. No, beside teeth, you have to think of his skeletal system, you have to think of his soft tissues. You shall give a proper structural balance, stable orthodontic treatment. For example, I have given 6 orthodontic appliances to the patient. The patient's teeth are well aligned, patient is happy and going. I did not look, I did not concentrate on the gingiva, whether my treatment is affecting the gingiva or not. Maybe I have not given a proper occlusion to the posterior side and the patient is having cheek bite, or maybe I did not align the roots in a proper way. So after some time again the patient is having a reversal of the problem. So an orthodontist shall provide, number one, functional efficiency to the patient to perform all normal chewing functions. Number two, we shall provide a good structural balance. And third is aesthetic harmony. When there is a malocclusion, definitely patient is not happy with the aesthetics. But when you provide a good alignment of the teeth, patient is happy and his aesthetics is improved. Ultimately, patient would be able to enjoy his life. Everybody loves its appearance, so definitely any patient with compromised aesthetic will be disturbed. So our motto is to provide aesthetics as well. What are the unfavorable conditions related to malocclusion? What could malocclusion cause? Number one, due to malocclusion, patient, especially when the patient is having proclined anterior and anterior teeth. For example, these are central incisors, upper central incisors of the patient. Due to these proclined teeth, patient will have a bad aesthetics. Maybe patient is called, I will show you the picture later. Maybe the patient is called with bad words from his friend. That's why the patient is not going out, not hanging around with the friends, not going to the school, not concentrating on anything. An adult patient is not going to the job properly. Everybody is making fun of him. So everybody wants to have good facial appearance, and malocclusion can produce adverse effect on the appearance of the patient. So the first unfavorable condition that is related with malocclusion is poor facial appearance. Patient look ugly. Number two, due to malocclusion, can you see here malocclusion? Can you see the status of the gingiva or status of the periodontal health is compromised? Due to that compromised health, what will happen? Patient will have not only the periodontal problem, but the patient may have caries. The stagnation of the food, these areas where the food is stuck and it is not easily wiped off, it cannot be easily cleaned off. So patient will have high chances of caries to occur. So malocclusion can lead to caries due to bad oral hygiene. Again, due to this malocclusion, the patient will have a lot of periodontal issues. Poor oral hygiene, patient may have, traumatic occlusion. This is traumatic occlusion. Patient is trying to bite, but the abnormal contact of anterior teeth is producing continuous trauma over the central incisor. And this traumatic occlusion may be because of this tooth. This tooth is more palatally placed, and patient is trying to bite. This tooth is going to contact or going to hit the tongue. This way, the patient is having trauma, continuous trauma, either on the gingiva, either on the tongue, or due to the abnormal contact of the teeth, front teeth. There is no proper occlusion at the posterior region. So that's why the patient will have a lot of problems, chewing problems, eating problems. So right now we are concerned that how malocclusion produces periodontal disease, the abnormal contact of the teeth, or improper cleaning due to malpositioned teeth may lead to bad oral hygiene and lot of periodontal tissue damage. Risk of trauma, as in the first picture I told you, when some patients are having procline teeth, due to those procline teeth, the child is called by his friends rabbit or with different names, and that is giving patient a psychological disturbance or psychological trauma. That is number one. Number two, when these teeth are more procline, can you see here the patient is not having proper lip seal? Why we are given lips? This proper lip seal, if there would have been a proper cover of the lips over the teeth, the patient will be prevented from the trauma. In this picture, this child is more prone to trauma. Any blow or any hit, will directly affect the patient. Because when you see his facial appearance, these teeth are more procline and more prone to the trauma or risk of injury. Here, this picture is telling you like this: child has during play or during, exercise or whatever, the patient got the trauma and his tooth is broken. It was only because of malocclusion, because the tooth was not placed properly in the jaw. That's why the patient got the trauma to his tooth. Could be due to game, could be due to accidental fall or anything else. But such teeth are prone to hit. This is again a drawback, or this is again a problem that arises due to malocclusion. Then psychological disturbance, again, we are talking about, we have talked about it, that bad aesthetics give psychological trauma. Bad aesthetic does not allow patient to move out, to go into the society. As I told you, the patient are more, introvert, and the patient is very much, conscious that I don't look bad, with everything I look ugly. So that will, give a lot of psychological disturbance not only to the child, but his behavior may ultimately affect the family. So again, this is due to malocclusion. Abnormality of function, as I told you before, that when there is no proper contact between the teeth, that may lead to improper swallowing pattern, difficulty in speech, and improper respiration. When the teeth are not in a proper occlusion, the patient will have a lot of problems, maybe improper chewing. There could be, improper swallowing. Now this patient is not having a proper, occlusion. Due to improper occlusion, what will the patient do? Now he or she, in this case, is not able to chew properly. What the patient will do? Patient will try some abnormal ways to chew the food. Patient will try some abnormal ways to swallow the food. So this way, due to malocclusion, the abnormal positions which will satisfy the patient's demands will make it habit. That habit will ultimately lead to other problems to arise. So abnormal functioning is again due to malocclusion, and that will again lead to a lot of other problems to that patient. So in abnormal function, patient is having improper swallowing pattern, patient may have difficulty in speech, or patient may have abnormal respiration. Number 7, temporomandibular joint pain. Due to malocclusion, the patient may have premature contacts. Normally what happened, we shall have proper contact between the upper and the lower teeth. This is the lower molar and this is the upper molar. Number 1. And this is again, as normally in orthodontics we say that the mesiobuccal cusp of upper molar should lie in the central groove of lower first permanent molar. This is normal class 1 occlusion. This, I'm not talking about malocclusion at this point. This is normal occlusion. But when we see here in picture number 2, this is not normal occlusion. This is malocclusion. Can you see here point-to-point contact between the teeth? Normally, the mesiobuccal cusp of upper molar was supposed to lie in the central groove of lower first permanent molar. That is normal occlusion. When normal occlusion is not present like this, and there is some other way the teeth are arranged, the posterior teeth are arranged, that is called malocclusion. This malocclusion due to premature contacts of the teeth will cause temporomandibular joint pain or TMJ pain. This is another problem which is related to malocclusion. Mal means abnormal occlusion. Now, interference to the normal growth and development. Can you see here in this picture, it's very nicely visible that the mandible of this patient is prognathic. Due to prognathic mandible, all the lower teeth are gone in a forward direction. When they are gone in a forward direction, what did they do? They have actually overlapped the upper or upper anterior teeth. All the anterior teeth of the maxilla, they are overlapped by the lower teeth. This is not normal. Here again in this example, can you see the maxillary teeth which were supposed to be forward? Normally the mandibular teeth were supposed to be here. But in this case, the mandibular teeth are more proclined. These proclined teeth, what did they do? Instead of maxillary central incisors overlapping the mandibular, here the mandibular central incisors are overlapping the maxillary. Due to this, can you see here, due to this contact, the upper arch, the maxilla will not be able to grow forward. Means these teeth, they are blocking your maxilla to grow forward, and due to that, the patient will have restricted growth of maxilla. This mandible, the mandibular teeth are not allowing the further forward growth of maxilla, and due to that, the maxilla will be restricted. The maxillary growth will be restricted and mandible will be free to grow. This will ultimately lead to class 3 malocclusion. So this way, the normal growth and development of the patient is restricted due to prognathic maxilla, the prognathic mandible. The mandibular teeth are overlapping the maxillary teeth and thus not allowing the maxilla to grow forward and thereby restricting the growth of maxilla. So those were actually the problems which were related with malocclusion. As I told you, due to malocclusion, there is a psychological disturbance, there are chances of caries to occur, there are a lot of periodontal problems which arise. Due to malocclusion, there could be abnormal contact between the teeth, which does not allow patient to chew properly and to balance, or to have to gain proper nourishment. Patient set and other abnormal, contact. So that leads to again malocclusion, and again malocclusion can lead to restricted growth of maxilla or mandible. So this way, these are all problems which are caused by malocclusion. So these malocclusion, the problem which are caused by malocclusion need to be treated. So what are the needs of orthodontic treatment? First, to give aesthetics. Number 2, to reduce the chances of caries. Number 3, to reduce the susceptibility to periodontal disease. Provide, to reduce the chances of accidental injuries to occur, like we talked about the example of the child with the proclined teeth. To correct abnormal muscle activity, to correct abnormal habits, like I told you, the habit of thumb sucking or habit of mouth breathing. To manage the temporomandibular joint problem, to facilitate the prosthetic rehabilitation, to correct speech defect, to intercept and correct interference to the normal growth. All those problems which we discussed before, which are occurring due to malocclusion, all are supposed to be treated with orthodontics. This is the need of orthodontics to treat all those problems. What is the scope of orthodontic treatment? Orthodontic treatment, as I told you, it is done to treat the dentition, means orthodontic treatment can bring about the changes in the dentition. It brings the changes into the skeletal system and your enveloping soft tissue. Ultimately, when you treat the dentition, skeletal system, and the surrounding soft tissue, what will you gain? Change in tooth position can be brought easily while treating the dentition. Alteration in the skeletal pattern can easily be brought by orthodontic treatment. And any abnormal soft tissue pattern can be again altered by means of orthodontic treatment. First, we are talking about alteration in tooth position. Means how are we altering the tooth position? There are several tooth positions which are made possible with orthodontic treatment. For example, in this picture, you see the tooth is more extruded. Extruded means it is more out. It is normally, when I say normally, this up till this level, the tooth is showing into the arch. If you think about the crown, up till here, the crown is shown in the arch normally. But here, maybe in this case, you see the light dotted lines at the back and the darker lines ahead. Here, the tooth is up till this level out. So this tooth is more extruded, more out. I need to put it back into the arch, so I need to have intrusion. So these dark lines, if you see the tooth is more out, I need to put it back into the arch, means I can easily intrude the tooth by means of orthodontic treatment. Similarly, when you can put the tooth inside at the same the same way, you can extrude the tooth outward. Here the tooth is more, sorry, this is the same picture I'm sharing here, but I'm again telling you another example. When orthodontic treatment can easily put the tooth back into the bone, it can help you take out the tooth from the bone. It can allow you extrusion. Here, for example, this is the tooth which is showing into the arch, and I know this tooth is not properly positioned, or I am doing treatment of an open bite. I want my teeth to be extruded out. I can easily pull this teeth out. Extrusion. We can take this movement, intrusion. We can do this movement, extrusion. Means I can put the tooth into the socket, or I can pull the tooth out of the socket. That is called intrusion, and the other one is called extrusion. These are two movement of the teeth which can be easily brought by orthodontic treatment. Now I can move the tooth bodily from this point till this point. I can move the tooth back. That is called bodily tooth movement. And again, the tooth is moving here. Here the root is present at the same point, only the crown is moving. I can take this movement also from orthodontic treatment. Means I can move the tooth bodily. Whole the length of the tooth, when it is moved, it is called bodily movement. I can gain, or I can get controlled tipping, where I am not touching the root, only I am moving the crown. So I can get this sort of movement. Also, I can rotate the tooth with orthodontic treatment. So these are all type of movements which are possible with orthodontic treatment. They are done when they are required. We can put the tooth back into the socket. We can take the tooth out of the socket. We can do bodily movement. We can do controlled tipping, or we can get rotation with orthodontic treatment. Also, we can alter the skeletal pattern. I can bring the maxilla forward. I can bring the mandible forward. I can get the maxilla backward. I can get the mandible backward. So this way I can change the skeletal pattern of the patient. In orthodontics, we whatever the movement we get, the movement is taken in some plans. The forces or the changes are taken in some, imaginary. We draw some imaginary, or we think of some imaginary plans. In those plans, we get the orthodontic movement. One is the vertical, another is the transverse, and the sagittal movement. This is the sagittal movement, this is the vertical movement, and this is the transverse. In these three directions, we can have a movement of skeletal pattern. Alteration in the soft tissue. Again, you see here, the patient is having proclined upper teeth, and also patient is having proclined lower teeth. Due to the positioning of the jaw, ultimately the soft tissue profile of the patient is changed. So once you treat the jaw, once you treat the maxillary or mandibular teeth, for example, if I will treat these teeth and they are gone like this, inward a little, and if I treat the lower and they are gone inward like this a little, what will happen? Ultimately, the tissues which were here before, they will a little change, and they will be also coming back as the movement of the teeth is gained. So this way we can alter the soft tissue pattern while treating or while bringing the changes into the hard tissues. So orthodontic treatment, with the orthodontic treatment, we can get changes in the tooth position, we can get easily changes into the skeletal pattern, or we can easily alter the soft tissue pattern. Thank you so much. This is my first class. I hope you understood orthodontics, and inshallah I'll be taking more classes on orthodontics and also other dental subjects. This is my contact number. You can WhatsApp me there if you have any query, and you can contact me on my given email address.